had is related to which are the top 5 recommendations that you could do to like a government level to implement health information system or EHRs.
If I'm going to give you 5 examples or 5 things that local governments might consider when, or at least 5 pieces of advice that people might consider when thinking about using health information technology to advance your healthcare system, is first of all to realize that healthcare is an information business. Let me repeat that. Healthcare is an information business. We think we're a service business, that we're delivering care. But I'm a general internist, and I don't do surgery. I don't manipulate patients. I don't massage patients. I don't hand out drugs. I gather information, I record information, I process information, and I transmit information. I'm an information person. And the efficiency, the speed, the completeness of which I do that depends upon the information medium I work in. Paper is inadequate. Paper can't be shared. Paper can't be backed up. I mean, we recently had floods in the United States from Superstorm Sandy. It flooded the basements of a lot of hospitals. Guess where they store their paper records? They're all gone. They're not backed up. They're completely gone. So if those hospitals didn't have electronic medical records, they have no records. It makes no sense. So the first thing is realize that healthcare is an information business, and you have to have a way of storing it in a way that's retrievable, regardless of where patients go for care. So if you buy that it's an information business, then you can't live with computers in healthcare any more than you can have banking without computers. In fact, it'd be easier to have banking without computers than healthcare without computers. Banking's easier. The second thing is think broadly. I mean, think both, understand the individual doctor, nurse, patient interaction, pharmacist interaction. Think about that, but you have to think both in the small and the large. So what do these people need to help care for their patient? But then how do you manage that information broadly? In my city, we have 5 major healthcare systems. And we did a study that shows that if you come into one system, we did a study of more than 800,000 patients. And if you come into one system, within the next year, 50% of the time you're seen in one of the other systems, and 2/3 of the time you have a test result in one of the other systems. So if you're not thinking broadly, then the information is still not going to be there when you need it there. So think small. What does an individual provider need? But think large. What does the system need to care for you no matter where you go? Because people are going to go seek care wherever they want to seek care, and the information should be able to follow. Okay. The third thing is standardize. The systems have to talk to each other. Otherwise, you've got a Tower of Babel, and it doesn't help if the information come over and it's not something that I can display on a screen and understand. And what you need to think of is in terms of like Google. I mean, if I Google something and it comes up on the screen, I don't know where that information is coming from. It doesn't matter. It's in one place on one screen. We should have the same thing. If you're a diabetic and I want to see your blood sugars, I should be able to see them displayed on the screen, and it shouldn't matter where they come from. But if they all call them something different, if they're all used by different code, if they're all in the systems with different codes, with different normals, with different measurement scales, then the information coming back will not tell me anything. And so there are standard coding schemes, and these systems have to use them. If they don't use them, then the information is getting that information is not going to be helpful because we can't display it. The third thing is don't think in terms of making the current paper chart electronic. We could do that by scanning paper records into a chart. That's not an electronic medical record. That's an electronic version of a paper record. And yes, it follows the patient. It's more readable. But the data can only be used by one person reading it. It can't be used for quality improvement. It can't be used for looking for trends. It can't be used for research. It can't be used for anything other than a human being reading it. And that's the lowest level. I mean, it's important, and I take care of patients. I read reports, and I can get information out of them. But if I want to know how all my hypertensive patients are doing, I want to be able to see their average blood pressure. If that information is just in a scanned piece of paper, I can't get that information. So let's get away from text. So the third suggestion is let's start thinking of, now that we're having this medium, this electronic medium, these electronic records in many places, let's start thinking of getting beyond the paper chart and start thinking in terms of what information is needed at each type of visit. And and how do I record that information in a standard way so that we can analyze it, we can present it in ways that can help providers, managers, quality improvement programs, governmental regulators, whoever wants to see this information, the information is available to them. Okay. The fourth thing is treat medical informatics like a specialty. It's not just a bunch of computer geeks running around programming computers. I think that's what it has been in many places, and I think that's a problem. The best computer information systems or health information systems are ones that are developed by clinicians for clinicians. So think of it as a specialty. As much as radiology is a specialty. You know, people taking pictures of x-rays, you know, it's a specialty that is supportive of other people doing their job. So if I'm taking care of a patient in the emergency room who comes in with a cough and a fever, I get a chest x-ray. It tells me the patient has pneumonia, I can then care for the patient. Okay? Similarly, if I have a patient with diabetes, and I can look up in their record and see from all the different places that the patient diabetes is out of control, and from the pharmacy they haven't been getting their medication, then I can care for that patient to make sure they have access to their medication, find out the problem and get it fixed. I can only do that if I have the information. So it takes clinicians to know what clinicians need. And to take, I would encourage governments to take health informatics seriously as a medical specialty. My country finally has, just this year, it is being made, clinical informatics is being made a medical specialty by the American Board of Medical Specialties. I would encourage all countries to do that, because it's as fundamental as anything else in healthcare, and it affects everything in healthcare. Unlike cardiology, which doesn't affect everything in healthcare, this doesn't affect everything. I mean, this affects every single aspect of care. Information is care. Okay, and I guess the fifth thing is with target medical education, is that all things I've talked about assume that we've got healthcare providers of various kinds, physicians, nurses, pharmacists, therapists, etc., who know how to use this information. They don't. They're taught the same way now that they were taught back 100 years ago. And healthcare is different now. And they need to, the healthcare providers of today need to know about health information systems, how information is captured, how it's stored, how it could be used, and how they should build care systems around having the available information. That has to start fundamentally with the first day of medical school. In my medical school, and we're one of the hot spots of informatics, we have no training course in the use of medical information, not one. That's got to change, and we're in the process of revamping the curriculum and beginning to see that change. But I think we have to fundamentally take a look at the way that we train people in the healthcare professions, and if they understand it's an information business, teach them how to use information. If we do that, then I think you'll get the most effective use from the investment that countries make in health informatics.
Okay. Thank you.
How's that?
That's right.